the smallest artificial heart with full magnetic levitation. The coheart6, with a diameter of 34 mm and a weight of only 90 grams, is the world's smallest and lightest fully levitated artificial heart. In June 2022, coheart6 was implanted into a 14-year-old child with heart failure. After 100 days, the child's heart function was restored and the pump was successfully withdrawn, achieving reversal treatment for heart failure. In February 2023, the affiliated Children's Hospital of Zhejiang University School of Medicine successfully implanted coheart6 for a 12-year-old child with end-stage heart failure who weighed only 30.2 kilograms, setting a new record for the minimum age and minimum weight of pediatric artificial heart transplant patients in China. The scientific name of artificial heart is ventricular assist device, abbreviated as VAD. Its essence is a pump that can help promote blood circulation in the body, provide necessary blood supply to body tissues, and maintain necessary blood pressure. It mainly consists of 4 parts: blood pump, power device, monitoring system, and power supply. There are various types of artificial hearts, including left ventricular assist devices, LVAD, and right ventricular assist devices, RVAD, but the most mature clinical application is still left ventricular assist devices, LVAD. The artificial heart has one inlet and one outlet, and its inlet is fixed to the left ventricle. The outlet is connected to the aorta, and blood from the left ventricle is pumped out and then pumped into the aorta. This can partially replace left ventricular function, thereby improving the symptoms of left heart failure in patients and restoring normal life. The traditional treatment method is only heart transplantation, but due to donor limitations, patient rejection, infection, and other issues, the number of heart transplants that can be completed in China every year is only a few hundred, which cannot meet clinical needs. The heart pump function of patients with heart failure is severely damaged, and there is not enough force to eject blood. However, an artificial heart, through a blood pump device, can help its own heart pump blood, allowing the patient's heart to rest fully. After a period of additional medication treatment, some patients' cardiac function can be restored to varying degrees, thus achieving the goal of rehabilitation. The magnetic levitation artificial heart is the third and latest generation of products. Its advantages include less damage to blood, less prone to thrombosis, largely avoiding complications such as stroke. Compared to the previous 2 generations of products, the size is smaller, the thickness is thinner, the pressure on the heart is also smaller, and the patient's postoperative experience is also better. The cable is thinner, as it passes through the skin and leads out of the body. The thinner the cable, the easier postoperative care is and the lower the risk of infection. The range of traffic support is large, which can meet the clinical needs of patients with different weights. The blood pump has good suspension stability and excellent impact resistance. How to implant the all-magnetic levitation artificial heart into the human body? Currently, the implantation of conventional artificial hearts requires a central thoracotomy with the assistance of extracorporeal circulation. Firstly, after cardiac arrest, a hole is made at the apex of the left ventricle, and then the blood pump inlet is inserted into the left ventricle, sutured and fixed. The blood pump outlet is connected to the ascending aorta through a segment of artificial blood vessel. After the blood pump is implanted, the cable is threaded out of the skin and connected to the external control device and battery. After turning on the power, adjust the blood pump speed according to the patient's heart function status. After the human heart is working normally and the circulation is stable, remove the extracorporeal circulation. After the surgery is completed, it is important to focus on checking all anastomosis sites for bleeding and the location of artificial heart implantation. After the entire process is completed, the chest can be closed, which is a rough surgical process. The theoretical maximum flow rate that the third-generation artificial heart can provide is 10 liters per minute, far exceeding the 5-6 L per minute heart displacement required for patients' daily activities. This is like replacing a 1.4-liter displacement car with a 3.0T engine, which has very abundant power, far exceeding daily needs. So, after installing an artificial heart, patients can enjoy a high-quality life, engage in daily activities, and even return to work. Patients should carry 2 batteries with them for daily outdoor activities. One battery can be used for 6 to 8 hours, and the other battery is backup. The battery is also very convenient to carry, and usually there is a dedicated shoulder bag or backpack available for use. when the battery is about to run out of power, a high-pitched alarm will prompt the patient to replace it on their own. The 1-year survival rate of artificial heart implantation treatment is about 90%, and the 3-year survival rate is 82%-84%. At present, the equipment cost is 1 million yuan, and the surgical cost is 200,000 yuan. After the surgery, Ms. Pen was transferred from the ICU to the general ward on the 5th day. After 12 days, Ms. Pan's various indicators met the discharge requirements and she was discharged smoothly. Under technological innovation, artificial hearts have begun to replace native organs and perform tasks in the human body. Some people speculate, is there any hope of eternal human life? In fact, whoever wears an artificial heart needs to endure a life of not being able to soak in water, not being able to fly, and constantly listening to mechanical noise. However, the opportunity to survive created by artificial hearts is the greatest value at this stage. With the advancement of technology, artificial hearts are constantly upgrading and iterating. Perhaps one day, humans will invent mechanical hearts that have no side effects and do not affect the quality of life. Prior to this, we still need to rely on maintaining our cardiovascular system, which is a delicate and long-lasting way to extend our healthy lifespan.